Hi, this is Suzanne Clegg of SpiritGate.com, here with a question of my here with an answer to a frequently asked question regarding my cancer therapy. So I use energy healing, laying on of hands, distance healing, to cool down tumors, stop pain, bring comfort to people and pets with cancer. And I work with the patients directly, or I work with teaching friends and family members how to do a very simple method that is quite effective for, at worst, palliative care, making them feel better, and at best, much better, much more than that. So the question is, who responds to this? So first of all, is someone with a rapidly growing tumor, which is the good news, because so often we think that the bigger and badder the tumor is, the harder it will be to treat. But that's not always the case. So if you've got a fast-growing tumor, that's usually the tumors that cool down, that we can really see exactly what if we're doing. It gives us feedback. The slow-growing tumors, they still respond, and I know how to work with them. It might just take a little more talent or effort on my patient's behalf, or the person that's working with them, if they're a pet or a child or somebody who can't work on themselves. All right, so that's number one, is a fast-growing tumor. Number two is not at the end of their normal lifespan. I can't tell you how many people call me up with 12, 15-year-old dogs with gray snouts and say, can you help them? And I say, I think I can help them, but I think this is their exit strategy. We can bring them comfort, and we can give you something to do other than just watch them wither away and die. They still might die, but they're going to need a lot less medication usually, and you're going to feel like the whole thing wasn't just a waste. So that's nice with that. Then the next, so you need to be within your normal lifespan. So the dogs, if they have gray snouts, if they're kind of old for their breed, we can comfort them, but don't expect them to live a whole lot longer. Now with people, I've helped somebody who's 88 years old, and she had a tumor on the whole right side of her face. It was covering her. It started with her eyelid, and it just kind of grew. It was, I guess, a type of skin cancer, and it went down to the size of a quarter, and then she died of a heart attack. So I like to think that we helped her with her cancer, but we didn't really. The whole lifespan thing kind of came in there, and she passed on. But it was pretty cool for her son to have worked with her. It enabled her cancer became a gift for him, a new lease on life, as he felt empowered, because he really did, I would say, 99% of the treatments, and I would just touch base with him every once in a while and coach him and see if he needed help. And that is my goal, is to be the healer's trainer, not just doing all the work. But each case is what it is, so we work with that. Another thing that we need is that the ones who do well are those that respond, and you don't know if you respond until you try it. So that's why I like to try a couple treatments, see if we get a robust response that we're super excited about, like you feel better, you just get a lift, the tumor cools down, the pain goes away, even temporarily. That means this is worth continuing. If you get this little piddly response, and there's a lot of other factors, I can use my clinical experience to let you know what I think we're looking at. And I do have it right now. When I'm making this video, it is 2020, and I started working a lot with cancer about 15 years ago when I was mentored by Bill Bankston. And before then, of course, I had decades of work as an acupuncturist, nutritionist, herbalist, sound healer, and all that. So loads of clinical experience, watching energy medicine work, watching it not work, and kind of being able to know the lay of the land so that we can not waste our time if it's not working, and so that we can tweak it so that it does work if it's kind of sort of working and we want to help it along. All right, and then the other thing about who responds is younger. So not at the end of your normal lifespan sort of implies that the younger you go, often the better it is for you. Just there's something about being younger. I call it the etheric forces, that your life force is just stronger when you're younger. And you can just look at a puppy and look at an old dog, and you can just see what I mean. The life force is vibrant and robust in a young animal, whether it's a person or an animal or a pet. And it's just not quite as robust. You can be happy, you can be healthy, you can be vibrant, but this life force, you just don't repair as fast as you get older. So if you're younger and have cancer, I would very much encourage you to give this a try. All right, so watch. That's it for this question. Okay, bye.